According to the American Diabetes Association 2015, as of 2012, 29.1 million Americans have diabetes. Currently, diabetes is the seventh leading cause of death among Americans. Additionally, over $490 billion is being spent each year in America due to diabetes. These expenses include medical costs, productivity, days of work, loss due to complications from the disease. Since rates of incidence of diabetes are on the rise, Centers for Disease Control and Prevention 2014, the American Diabetes Association probably is having the most effect in the realm of education and support. Type 1 diabetes occurs at random. No one really knows what causes the onset of type 1 diabetes, which explains the reality of why there is probably not currently a cure. Type 2 diabetes is a little different. There are some risk factors associated with type 2 diabetes. Those factors include obesity, poor nutrition, genetic disposition towards diabetes, and a sedentary lifestyle. All people should work hard to treat their bodies as homes that will last over 100 years. And all persons should work to treat their bodies as an engine driven by exercise, nutrition, and food rather than a trash can filled with garbage. The American Diabetes Advocacy Department in Phoenix works with local legislators to ensure citizens of Phoenix with diabetes have rights. Many of those rights include access to safe places to test their blood sugar, especially for children who attend schools that do not have the proper places or nurses to do that. The ADA Advocacy Department also works with legislation to ensure that health insurance covers diabetes care. I've seen this particular effort personally. My insurance company has adopted a new diabetes initiative which helps me pay for preventative care and diabetic supplies and treatments. I appreciate this new level of care, which also works to prevent others from developing diabetes. The American Diabetes Association hosts programs at local schools as well. These programs help students manage their disease and teaches the entire school about diabetes, which decreases discrimination and misunderstanding. The ADA also leads programs such as health fairs and fundraising events that raise awareness of diabetes and encourage the community to support those who are already conflicted with this devastating disease. The state of Arizona is one that respects diabetes care and legislation that protects all of those with chronic illness. The ADA raises funds that go directly to diabetes research and health disparities and misunderstandings about diabetes causes and cares. Locally, the ADA educates legislators, teachers, schools, students, employers, and employees on diabetes care and the rights of those with diabetes. The ADA also has a national program that ensures that all students, both K through 12 and college students, are protected and informed of their rights when it comes to diabetes care. Education and information is important element of essential services of public health services. The ADA works hard locally and nationally to negotiate legal issues that arise in diabetes care. The goal of negotiation is empowerment of both employees and employers on the dangers of discrimination and the importance of understanding this very common chronic disease. Litigation is only necessary when rights are violated and the true nature of the chronic disease is not respected, especially when it comes to employment. Those with diabetes need to know the ADA will support them and that no job is off limits. Litigation is avoided at all costs and the ADA supports policy. Finally, legislation is required to ensure the needs of those with diabetes are met. It is not acceptable for diabetes, although it is an invisible disability, to be ignored or disrespected. The ADA works hard to ensure those with diabetes are protected by law and employee regulations. I would like to thank you. I am Greg Milliken, and this was my presentation.